The second type of innervation that the preganglionic fibers provide is the peripheral sympathetic innervation above or below the level of origin of the fiber. So what happens is the fibers that are coming in from the anterior root of the spinal nerve and enter the paravertebral trunk through the white ramus communicans and through the anterior ramus. When they travel into the sympathetic trunk, they sometimes or usually they descend or ascend to different levels, to different paravertebral levels, as this one has ascended to the other level, and here they synapse with the other fibers, and then the postganglionic neurons or fibers, they exit through the gray ramus and enter the anterior or posterior ramus and then innervate the associated regions that are innervated by the spinal nerve. Also, please note that the gray ramus communicans is present all across the paravertebral trunk, but the white ramus communicans is only present in specific areas, that is from T1 to L2. This is the only vertebral regions where we can find the white ramus communicans. And what are the organs or areas that are innervated by such kind of innervation? So, such kind of innervation, the main target for these kinds of innervations are in the head. In head, these are the innervations through this type of innervation, that was when the fibers, the preganglionic fibers, when they ascend or descend to different ganglions or to different vertebral levels, they innervate tissues in the head, also sweat glands, smooth muscles, and also muscles of the eyelid, and it also helps in dilation of the pupil, in the eye. The next type of innervation is the innervation of thoracic and the cervical viscera. And in this kind of innervation, the fibers, the preganglionic fibers that leave the anterior ramus through the white ramus communicans, they leave the trunk medially. And they supply to the viscera, and in this case it is the heart. Now sometimes these fibers, they may ascend in the trunk before synapsing, and after they synapse, they leave the trunk with other fibers from different levels, and they leave along with them their fibers in associated nerves, and they form named visceral nerves. For example, they form the cardiac nerves. Once again, the sympathetic innervation of the thoracic and the cervical viscera. What happens in such kind of innervation is the preganglionic fibers, they leave the trunk medially. When they leave the trunk medially, they travel to the viscera present in the thorax or in the cervical region. If it's in the thorax, we take an example of the heart, and they innervate the heart. And sometimes these fibers, they ascend without synapsing. They ascend in the paravertebral trunk without synapsing. And when they synapse, these postganglionic fibers, they join the other fibers from different levels and form named visceral nerves. These nerves are named visceral nerves. That is, the organ they're innervating is what the name of the nerve happens to be. For instance, the cardiac nerves. And spinal cord level T1 to T5, they innervate cervical, cranial, and thoracic viscera. The next type of innervation is the innervation of abdomen and pelvic regions. In such cases, the preganglionic fibers that leave the anterior ramus of the spinal nerves, they leave their specific ganglion without synapsing, and they join similar kind of fibers that haven't synapsed in their ganglions or haven't synapsed in the trunks. They form splanchnic nerves. They form splanchnic nerves. Now these are those fibers that haven't synapsed in their trunks and are converging with similar kind of fibers and forming these splanchnic nerves. The preganglionic fibers in these nerves, they arrive from the levels T5 to L2. These are the vertebral levels from where these fibers arrive and form the splanchnic nerves. These fibers, they connect with the sympathetic ganglions. They connect with sympathetic ganglion around the roots of major arteries that are branching from the abdominal aorta.